Raj Sood. I am the director of the Richard Fairbanks Burn Center. I was introduced to RECELL probably 10 years ago and became very quickly enamored with the thought of the concept. You took a very small biopsy on the operating table essentially, and then you were able to cover a very large area with keratinocytes and a lot of other cells.
I'm Dr. Foster, and this is the Arizona Burn Center at Maricopa Integrated Health Systems. I first heard about RECELL when it was introduced to a group of us as a potential research project. We were impressed with it early on because of the limited amount of donor skin that had to be taken to cover a skin graft. Normally, if you have a skin graft that's this big, you need a donor site that's this big. And with RECELL, of course, you can reduce that significantly.
I'm Jeffrey Carter, the medical director at University Medical Center in New Orleans. Having served on multiple value assessment committees for different hospitals, I'm very used to having to bring products in or to talk to other physicians. But this is one that's truly transformational in the sense that we see dramatically reduced lengths of stay.
One of the biggest advantages of RECELL is that you can use it immediately. It can be used in the operating room. It takes between 20 and 30 minutes to prepare the cells. And by that time, you're preparing the wound bed and getting the patient ready for grafting. And immediately, you can use it to cover.
We cover more area with each operation, and we get the donor sites to heal much quicker. So the amount of time that those patients spend in the hospital is really reduced. Their complication rate is reduced. There are a whole lot of benefits to it.
When you can take someone who would have normally had 100 or 200 day length of stay and whittle it down to 30, 40, 50, 60 days, you have a dramatic reduction in the total cost of care, meaning the cost of each day's care, the cost of multiple surgeries, the cost of any complications that would occur with that care.
One of the unique aspects of RECELL is that we are certainly delivering keratinocytes. We are delivering a number of other cells that are available at the dermal epidermal junction. Those are all important cells for wound healing. We can use it alone. We can use it in combination with expanded skin graft.
We've had multiple patients since starting this burn center that we've been able to treat with RECELL. And within a month of their surgery, they're back at work and off narcotics. And so that has a completely different return on investment.
We will be using that on almost every case that we take to the operating room.
There are a few opportunities we'll have in our practice lifetimes to be able to really engage with something that's going to be transformative for the care that we provide for our patients, where we can not only reduce their suffering, but improve their wound healing.
The use of this particular technology will absolutely change practice in the United States. And I think that's what a surgeon needs to know.